Kaylee. Today I'm going to be talking about vital signs and what they are and why they're important and how to do them. So hopefully by the end of my video you guys can perform taking someone's blood pressure, respirations, and even pulse. And hopefully these will help you all in a multitude of situations. The first vital sign we're going to talk about today is pulse. Pulse is how many times your throbbing heartbeat is felt through the wrist per minute, and it's pretty easy to take, and it's honestly really helpful if you need to know someone's breathing or if you want to know how many breaths you take per minute. So pulse can even be affected by high temperatures and humidity outside, strong emotions that you're feeling, overweight, or some medications. So different things can affect that, and normally the doctor, they will know. But if you're doing it on your own and you see some weird numbers, then would just contact your local doctor and tell them, and they would know how to fix that. Pulse, you can find it in the wrist or the neck, but it's normally easier to do in the wrist. And you're going to want to get a stopwatch, and you're going to want to set that for 60 seconds once you find the pulse. So you're going to take the wrist, and on the thumb side, you're going to feel right at the top and keep feeling. Okay, so I just found the pulse, so I'm going to want to hit my stopwatch. And I only felt for 30 seconds, but you can multiply that by 2. And I got 32, which would be 64, which is a pretty normal pulse. And that's how you do that. If you want to know more details about it, you can look that up. I'm going to link a tutorial in my PowerPoint. We're going to talk about blood pressure. So blood pressure is the pressure of circulating blood in your body. And the number on the top is called your systolic, and the average range for that is 60 to 90. And the bottom number is called your diastolic, and the average range for that is about 100 to 125. And your blood pressure can tell you a lot of things. If you have high blood pressure, you can probably go to the doctor and get on medication for that, which you normally figure those things out at the doctor. And if you're feeling very anxious and stuff, that normally means your blood pressure is up. But it can also tell you other things. 1 in 3 adults have high blood pressure, and high blood pressure can lead to strokes, blood clots, aneurysms, heart failure, and dementia. A lot of bad things. But when you can take it for yourself at home, it helps a lot. You don't have to make a trip to the doctor, and it's good to know it. So here's how you do blood pressure. So you can buy a little monitor normally anywhere, like Walmart or CVS or Walgreens. And you're going to open up the tab. And you're going to want to make sure that this red part, they're normally red, is facing down. And you want your patient to be wearing short sleeves and have their legs uncrossed. And if they don't talk, it'll give you a more accurate reading. You're going to want to adjust it to where it fits their arm. Does that feel good? Mm-hmm. Okay. And then you're just going to press on. And this is how you do it automatically, but manually can give you more accurate readings sometimes. They normally do that at the doctor though. It's a little harder to do that, especially on yourself. But I have a link clicked for that if you guys want to know how to do that as well. And no matter how old you are, it's helpful to know your blood pressure. and his is 119/78, which is a pretty good reading. As you can see, this is your systolic right here. I know that's backwards. This is your diastolic, your bottom number, and then it even gives you a pulse, and his is 75 right now. The vital sign we're going to be talking about are respirations, and that's how many times a person breathes per minute. Normally, the range is 12 to 20, and if you're an athlete, it might be a little lower, like anywhere from 10 to 12. That's not abnormal though. And they're pretty easy to take. You normally don't tell the person when you're taking them though, or they might breathe a little differently or concentrate on their breathing, and you want to make sure you get an accurate measure. So here's how you do that. Can vary in different age groups. Normally infants are going to be around 40 breaths per minute. Children are going to be a little less, maybe around the 2 to 5 year old age group would be around 20 to 30, and it just goes up from there, or it goes down from there. So when babies are first born, they take in more oxygen and release more. But yeah, those numbers change when they get older. Respirations, you're going to want to get a stopwatch, and you're going to want to do that for 60 seconds, and you're just going to observe how many times the person breathes in and out. So just breathe normally. You're going to want to watch for chest rise and fall. Normally you can see that pretty good in the back. Normally when they do this at the doctor, they don't tell you, just so you don't breathe any differently than you normally would. I got 13, which is pretty normal, and that's pretty good. So they're pretty easy to do, and you can do them on any age group. Your older sister has been complaining of feeling lightheaded and dizzy all day, and she comes to you and tells you this, and by taking her pulse, it can tell you how much oxygen she's getting, and if the numbers are really low, that could mean she could pass out, and it will just tell you more and can prevent things from happening. But overall, I know these tips aren't perfect and the tutorials aren't either, but hopefully you guys know how to take some vital signs now, and if anyone needs you or if you just want to do it on your own, you know how. So if you want to know more, you should definitely look at my PowerPoint, and you can do some searching on your own, but I have some more accurate tutorials linked on the PowerPoint. So yeah.